51-year-old Umar Aliyu has been in the bushmeat business for nearly 20 years. Despite the trade and consumption being linked to diseases, his sales haven't been affected.
We've sold bushmeat here for years, and none of my customers have complained about any sickness. It's very healthy and a good alternative to red meat.
The consumption of bushmeat in Nigeria dates back many decades. Antelope, porcupine and alligator are some of the favorites. According to US-based environmental organization Wild Aid, 70% of Nigerians have consumed bushmeat at some point in their lives. It says taste and flavor are significant factors influencing bushmeat consumption in the country. The World Health Organization says nearly 80% of emerging infectious diseases like Ebola, HIV and monkeypox in the last 10 years have been linked to the wild or bushmeat trade. But some of the consumers we spoke to don't have concerns.
I've been eating bushmeat now for the past 5 years. Me and my children and my family, and we are very okay.
As I'm even telling you now, I have it stocked in my fridge. I don't eat cow meat since 2019 up to date. And I find that it's very good to the health, to my health.
Since the first outbreak of monkeypox in 2017, Nigeria has had periodic episodes of the disease. In 2022, more than 30 cases were confirmed, and the government is now warning Nigerians to stop eating bushmeat as it moves to curb the spread of the disease.
Domestic and wild animals transmit diseases to man. Monkeypox, we are looking at animals that are not properly prepared. Because when these animals are infected by the virus, the hunter may not know. You come in contact with that and you bring it home. Even getting in touch with it alone is enough to let this virus come onto you. Particularly, if you have abrasion of the skin, it can penetrate through that and then cause havoc.
But experts say that beyond such warnings, there's need to have regulatory systems in place to ensure that people at the grassroots level are sensitized on how bushmeat should be handled, from the wild to the plate.
That the World Health focal person has to be part of the active surveillance, whereas he knows where they are selling bushmeat and they are eating it in bukas and restaurants. So it's for him to go and inspect. It's for him to go and inspect, and there should be a team.
Last month, Nigeria's Center for Disease Control activated a monkeypox emergency operations center to monitor and assess the risks of the outbreak.